Welcome to the Beverly Hills Plastic Surgery Podcast. I'm Dr. Jay Calvert. Today, here with my very normal-sized nose co-host, Dr. Millicent Ravello. How are you doing?
I'm good. How are you?
I'm just admiring your normal-sized nose.
Why, thank you. It's a little big for my taste, but on average, I guess it's normal.
Well, the reason that I'm talking about big noses is because we had a patient, and this is the No Big Nose podcast, just in case anybody's wondering. They came in for a revision rhinoplasty, and they said, well, I know I need a revision. I just don't want a rib graft because the last thing I want is a big nose.
Oh, no.
Yes. So because the internet, in all of its wisdom, Internet. Yeah,
Dr. Google.
Dr. Google, mm-hmm. Dr. Internet.
Gosh, that guy knows not a lot. But yet so much.
So much information that is just so wrong. The internet has convinced patients who are getting rib grafts that now they must have a huge nose.
That's unfortunate.
Which is not true.
That's not the case at all.
No. Just because rib cartilage is the donor site for the grafts that we need to do a revision rhinoplasty, it does not necessarily mean that the nose needs to be huge.
Well, I think there's a misconception because people, they don't know. They don't know what happens in surgery and what you're actually doing with that rib.
Right.
The conception is that you're, carving out a piece of your rib, their rib, which you are, and then just, sticking it on the nose.
Stuffing it in there.
You're like, all right, looks good, right?
That is not how it works.
That's not how it works.
So, reference the You Don't Know podcast, first of all. But second of all, look at what is done in a revision rhinoplasty. The idea is that you're going to undo the bad rhinoplasty and then build the nose and do the rhinoplasty that should make the nose look better.
Right.
And the graft material is incidental to that arc of progress in your aesthetic and functional aspects of your rhinoplasty.
But very, very critical because you need structure in that nose. You don't need it to be a big nose, but you need it to be able to hold itself up.
Correct. And just because you're using rib cartilage as the donor site doesn't mean you have to cut giant grafts.
No.
This is a huge misconception.
No. You're taking that piece of rib, and I'm sure you have plenty of videos on it, and you are carving it into very thin or thinnish or thickish, whatever size you need for whatever area you're putting it in. But you're carving it into the size that you need for that nose, and you're using it to make support and to make structure. But you are not using the entire piece of rib in one shot.
No, and that's a really old concept. So it's not totally unfounded. First of all, there are some people who use rib grafts and make huge noses, so we can't sit here
so there is that
and say that doesn't happen. I mean, I have people within, a half mile of here where we are right now that when they do revision rhinoplasty, the noses turn out bigger, and they like that.
That's what they want.
A problem. But this is why it always comes down to look at the before and after photographs of the operating surgeon. That's what you're going to get.
That's what you're going to get. And just because it's rib doesn't mean it has to be large.
No. In fact, if you look on my rib graft revision section on my website, there are some huge noses that were made with rib grafts that I then downsized using rib grafts. In some cases, new rib grafts, because I couldn't use the grafts that were in there. They were just not right for the job that needed to be done. So this concept has to get demolished. Somehow, we have to have patients not think when they hear the term rib graft that they have to have a giant nose.
No, because that's just not the case. The nose that they're going to have is going to be the nose that they see on the website, that they see in the befores and afters. And how you get there doesn't really matter because that's what the outcome is going to be, and that's what it's about. But for these tricky revision cases, you need rib, and there's no way around that. You can't really do it with any other graft substitute. I mean,